Everyone, welcome back to my YouTube channel, and today we are going to talk about phonics abscess. So let's start topic with introduction. Phonics abscess is an acute exacerbation of chronic periapical lesion, usually occurring after the lesion has been previously asymptomatic. It is also referred to as acute exacerbation of chronic periapical periodontitis. The term phonics symbolizes recirculation as the previously quiescent lesion come back to life with acute symptoms. Prompt recognition and management are essential to relieve pain and prevent further complications. Definition: Phonics abscess is defined as an acute inflammatory flare up of previously chronic periapical lesion characterized by severe pain, tenderness, and swelling, typically occurring in a tooth with necrotic pulp or previously asymptomatic chronic periapical periodontitis. Etiology: Phonics abscess usually develop due to disturbances in microbial balance of chronic periapical lesion. Common causes include introduction of bacteria during treatment, that is, during instrumentation or restorative procedure. Previously dormant bacteria may trigger acute inflammation. Second cause may be progression of chronic periapical lesion, as chronic granulomas or cysts may become acutely inflamed due to secondary infection or mechanical irritation. Third cause may be iatrogenic factors as over-instrumentation, overfilling, or introduction of irritants during root canal therapy. Fourth cause is occlusal trauma, that is changes in occlusion that may precipitate acute flare-up in a chronic lesion. Fifth is immune response alteration, that is reduced host defenses or systemic illness that can trigger acute inflammation in previously chronic lesions. Pathophysiology: Chronic periapical lesions contain bacterial colonies and necrotic debris. They are usually encapsulated and asymptomatic. A trigger that may be mechanical, microbial, or iatrogenic initiate neutrophilic infiltration and acute inflammation. Edema, pus formation, and increased intrapulpar or periapical pressure result in severe pain and swelling. This acute phase may progress to abscess formation if untreated. Clinical features include pain, swelling, and tooth examination things and other signs. Pain characteristics include sudden onset of intense throbbing or stabbing pain. Pain may radiate adjacent to jaw or head. It is often spontaneous and aggravated by biting or percussion. Second is swelling, that is localized soft tissue swelling that may be present in the vestibular lesion. It fluctuates, it may indicate pus accumulation. Third is tooth examination, that is tender to percussion and palpation. Tooth may be slightly mobile due to ligament inflammation, and it may be previously asymptomatic teeth may now show marked discomfort. Other signs include regional lymphadenopathy that may be present and mild systemic symptoms like fever and malaise in severe cases. Radiographic features: Pre-existing chronic periapical lesion is visible as radiolucency at the apex. Acute exacerbation may not show additional changes initially as bone resorption lags behind clinical symptoms. Chronic lesion may have well-defined borders indicating previous quiescence. Differential diagnosis: Acute apical abscess usually arises de novo, not from chronic lesions. Acute apical periodontitis is pain without pus formation or significant swelling. Periodontal abscess originates from periodontal pocket, and cracked toe syndrome is pain or biting that with no radiographic periapical lesion. Management include elimination of cause, pain and infection control, and supportive care. Elimination of cause is done by root canal therapy, that is removal of necrotic pulp tissue and debridement of the canal. Excess is through the tooth that may allow drainage of pus if present. Extraction may be indicated if tooth is non-restorable. Pain and infection control is done by analgesics for pain reliefs and antibiotics only if systemic involvement or rapidly spreading infection is there. Supportive care include warm saline rinses and occlusal adjustment if trauma contributes to the flare-ups. Prognosis is good if promptly treated with root canal therapy and drainage. Untreated phonics abscess may lead to acute apical abscess, cellulitis, or systemic infection. Early intervention allows preservation of tooth and resolution of acute symptoms. Clinical significance is that phonics abscess is an important consideration in endodontic flare-ups. Recognizing the condition allows appropriate emergency management, preventing unnecessary extraction, and differentiation from de novo acute abscesses or periodontally derived abscesses is essential for correct treatment. Conclusion of this lecture video. Phoenix abscess is an acute flare-up of previously chronic periapical lesion, presenting with sudden pain, tenderness, and sometimes swelling. Etiology involves mechanical, microbial, or iatrogenic triggers in previously asymptomatic teeth. Diagnosis relies on clinical examination, pulse vitality tests, and radiographs, while management includes root canal therapy, drainage, pain control, and infection management. Early treatment ensures relief of symptoms and preservation of the tooth. And this was all about phonics abscess. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.